Well, this morning on Moms Every Day, I'm joined with Melanie Sanborn. She is at Shriners Hospital for Children. And for a lot of parents, their kids get nervous about going and seeing a doctor, and this can be a scary time. So let's start this morning with what is a pediatric hospitalist, and who does that benefit the most?
So Shriners is an mainly pediatric orthopedic hospital, and my role as a pediatric hospitalist is I do everything else but bones. And so the orthopedists will do the surgery, anesthesia will do the pain control and put them to sleep, but my job is to do anything else. And so if they have lung trouble or seizures or any past medical history that's concerning, I take care of those elements of their care.
And so how in fact do you communicate with the child's own pediatrician, and how does the communication work so both kids and parents can be at ease?
Typically what we do is we see them in the clinic beforehand and vet them for surgery, and then we have a care management program which is in touch with their pediatrician and their specialists that may care for them. And then I usually get in touch with the pediatrician after surgery is completed or before if there's any questions, and just make the communication lines open so that it facilitates good care.
And so here locally we have a Shriners Hospital, but you know, across the whole country, what kind of conditions do you all treat?
We treat everything from everyday fractures where your kid is falling off the slide and breaking their leg to complex medical conditions like dislocated hips, scoliosis, and various other surgeries we do.
And so here locally then, what kind of you know, medical care is specialized to just this region?
We actually have some club feet specialists as well as hip specialists, and we have 2 surgeons that are doing scoliosis surgeries.
Wow, impressive work. And you know, as a parent, you never want the worst to happen for your child. And
No, I know
so
exactly what you mean.
in terms of Shriners, what makes it so unique from some of the other hospitals in our region?
I think that we have the only center which does pediatric orthopedics. Other places in the city have orthopedic doctors, but children's bones are so different and they're still growing. And so not only do we have pediatric orthopedists, but we have a great nursing staff, and we have places for the kids to play, and it's just such kid-centered care, and we know that with the kid comes a family. And so we have a very special organization that really curtails treatment and facilities for not only the patient but the family as well.
And finally, your upcoming 1 year in this
am.
role.
Yep,
This is exciting time. Well, how is this different from any other place you've worked?
I have to tell you, I've worked as an office pediatrician and as a hospitalist on a pediatric floor, but this is a totally different challenge. We get to see kids with very, very rare diseases, which I feel like I'm opening a book every day and learning something new. So it's a very special environment and a wonderful opportunity for me.
Wonderful. Thank you so much.
Thank you.
More on our website, myfoxspokane.com.